You guys, welcome to Sick of Pricks, a type 2 diabetes podcast. I'm Mary, your diabetes bestie, and today we're tackling something that can feel overwhelming, but it's also really important. What kinds of doctors and specialists do you actually need when you're managing type 2 diabetes? Because let's be honest, the medical system can make you feel like you need a whole lineup of people in white coats just to stay alive. And while, yes, the support matters, you don't need all the doctors in all of the land. You just need the right ones at the right time for the right reasons. So let's break it down. No fluff, no overwhelm, just real talk about who you really need in your corner and how to know if the doctor you're seeing is right for you. So let's start with the basics. If you only remember one thing from this episode, let it be this. Your primary doctor is your first point of contact. They're the ones who are making the referrals, checking on your labs, keeping track of the big picture, right? They're who you go to if you're not feeling well. They might be who you go to get your flu shot. They are the ones who you contact if something is amiss, right? They might not know every detail about diabetes medication or nutrition, but they're the person you see most often. And they're usually the ones who can connect you with the right specialist. Next up is the endocrinologist. Now, not every person with type 2 diabetes sees one, and that's totally okay. But if your blood sugars are hard to manage, your meds aren't working, you're not happy with where your numbers are, or you're dealing with more complicated stuff, maybe you have other diagnoses that affect your diabetes, an endo could be worth it for you. They are the hormone experts, so to speak. Now, a couple of questions to ask yourself first before you schedule that endo appointment, because these things matter. Number one, are you satisfied with the care you're getting from your primary doctor? If you are, you don't necessarily need to see an endocrinologist, okay? If your numbers are in range, if you're happy with the care you're getting, if your primary doctor is knowledgeable about the medications that are available to you, if it ain't broke, you don't need to go anywhere, okay? Second, is your insurance going to cover a visit with an endocrinologist? Because not all of them do. So that's something to take into account, the cost. It shouldn't be, but it is. The third is, how far away is the closest specialist office? Are you going to be driving 100 miles? May not be worth it to do that. We all live, in different parts of the country. Some we have plenty of options nearby, some of us barely any. So these are just things to take into consideration. But most importantly is, are you happy with the care you're receiving right now from whoever manages your diabetes? And then there's the diabetes educator. And depending on your past experiences, you might find these encounters 100% worth it. Or you may find, as one of our sisterhood members said on our coaching call on Tuesday night, that she found her diabetes educator visits full of bullshit. So it just depends on your experience and, of course, the diabetes educator that you're seeing. These are people whose sole purpose is to help you actually live with diabetes, how to use a glucose meter, how to count carbs, how to problem solve real life food situations. Oftentimes they're nurses or dietitians or pharmacists who, in theory, should get what you're going through on a day-to-day basis. So take that for what it's worth. If you've never seen a diabetes educator, I would say it's worth a visit, especially if insurance coverage is on your side, because it's nice to talk one-on-one with someone. All right, let's get into the bigger team of people, okay? These are the silent areas of diabetes that a lot of times people forget about until there's a problem. So we have the eye doctor or the ophthalmologist. We know that diabetes can mess with our eyes long before you notice any blurry vision. So an annual dilated eye exam is a non-negotiable. I go every year. I hate it, but I go anyway because I'm trying to be a big girl, okay? Catching changes early can literally save your sight. Next up, a podiatrist. If you have numbness, tingling, wounds that don't heal, or you just want someone to check your feet once a year, a podiatrist is key. They help prevent small issues from turning into big ones. Now, I personally do not see a podiatrist. My endocrinologist currently does a foot check every time I'm there. So they check the feeling in my feet and my toes, they check the pulses in my feet, and I've never had any issues. But if you are noticing changes in your feet, noticing that you have calluses or sores that aren't healing, a podiatrist might be a benefit for you. Okay. The next one is a nephrologist, which is a kidney doctor. And you might not need one of these unless your labs show early kidney issues, but knowing they exist and where you can call if you have issues is important. Diabetes is one of the top causes of kidney disease, and catching it early in those labs that you get regularly, it gives you options. Now, here are 3 other specialists that you might need along the way. Good to have in your back pocket should the cause arise. You may need a cardiologist. The link between diabetes and heart health is strong. If you've got high blood pressure, high cholesterol, or a history of heart disease, or a family history of heart disease, this is someone to have on your radar. Know who to call should you need it. Next is a dietitian. A dietitian isn't necessarily about giving you a meal plan of boiled chicken with broccoli. A good dietitian helps you find what actually works for your lifestyle and your blood sugar goals. And the last one, you guys, is super important. A mental health professional, because let's be honest, diabetes doesn't just live in your body, it lives in your head too. Okay, the stress, the burnout, the emotional weight of this diagnosis are real. So therapy, coaching, counseling can make a massive difference. Here's the part that might surprise you. You don't need to collect every specialist like Pokemon cards. If your blood sugars are steady and your primary doctor is on top of things, you might not need an endocrinologist right now. That's okay. If your feet are fine, like mine, you don't necessarily need a podiatrist appointment every 3 months. If your labs are normal, you probably don't need a kidney doctor on speed dial. The goal isn't to overwhelm yourself with appointments. It's to build the right team for you and your needs. When I was first diagnosed, it felt like every doctor wanted a piece of me. I had appointments on top of appointments, and honestly, it was exhausting, and I wondered how I was going to fit everything in with my day-to-day just life stuff. Eventually, I realized I didn't need to see everyone all the time. I needed the right specialists at the right times for the things that I was actually dealing with. That shift took a ton of pressure off and made me feel like I had a team, like a close-knit team versus like an army of people. Okay, so now you know the who, but here's the part nobody tells you. The fit matters just as much as the title on the door. Because listen, just because a doctor is great on paper doesn't mean they're the right doctor for you. You can read the reviews that other people leave, you can be excited like you found the one, but the vibe might not match what you need. So how do you know if they're the right fit? Here are some signs that you're in good hands. They listen without rushing you through your 15-minute time slot. They explain things in a way that makes sense, not just in medical jargon that makes you feel stupid. They treat you like a partner, not a project. They ask about your lifestyle, your goals, your concerns, not just your A1C. They respect your boundaries. For example, if you're not ready for a certain medication or treatment, they don't shame you. They lay out options and work with you. You leave appointments feeling clearer, not more confused, not judged, not angry, not down. You feel empowered. Now, here are some red flags. They blame you or shame you for your diabetes. And you guys, we're just not about the you did this to yourself stuff. We're not doing that. They don't look up from their screen. They don't ask you questions. They just tell you what to do. You feel dismissed, talked down to or like you're wasting their time. You guys, I recently decided to stop seeing my endocrinologist for exactly some of these reasons. Now, I have been going to this particular practice for 16 years since I was pregnant with my daughter. That's a long time, okay? And every visit I have there, there's something that I am uneasy about, something that ticks me off, something that makes me feel like, do these people even know me at all? And you would think with what I do every day that it would be an easy conversation at my appointments, but it always leaves me kind of pissed off. And I just decided recently, like this week, that I'm not doing that anymore. I'm just not. So I had a regular visit with my primary doctor, just a 6-month follow-up. And I asked him if he was comfortable managing my current regimen. And he said yes. And so I have decided to leave the endocrinologist, go back to my primary doctor. Now, here's a couple things about that. When I started at the endocrinologist, again, I was pregnant with my daughter. I needed specialized care. I was on insulin 4 times a day, and we had to closely monitor my blood sugars because of the pregnancy and how hormones can affect all of your levels. So after she was born, it was a good 2 years before I started really taking care of myself. And for a while, I saw the nurse practitioner who basically saved my life. She was the first one who really treated me like a person and not just a chart number, and really made me believe that I was worthy of taking care of myself and that I wasn't a failure if my numbers went up and that these numbers were just data. And I really just felt comfortable talking to her and going to visits no matter what the numbers showed because she made me feel so comfortable. Since then, she has left the practice and I have been seeing other providers, and it's just not doing it for me. I feel uneasy after every appointment. Like, why did I even bother? And the thing is, since, I don't know, 13 years ago, I'm a very different patient. I went from living in denial to being an advocate, to teaching people how to advocate for themselves, to being in the driver's seat of my health. So my knowledge has changed. My approach has changed. I feel like I'm in a really good place in my management to where I can go back to my primary doctor with confidence and abandon the endocrinologist. Now, that doesn't mean this will be a forever thing. If my body changes and things go crazy, I can always go back. I might not go back to that practice, but I can always go see another endocrinologist. So that has been the biggest change in my diabetes care that's happened in a long time. So I'm excited. I go for blood work at the general doctor at the end of the month, and we're going to run all the things, and we're going to go from there. So I took my emotions into my own hands and decided that I didn't need to keep going somewhere where I didn't feel that I was getting the care that I wanted. Okay. So what do you do if the fit isn't there? So if you're in a similar situation that I was, what can you do? Number one, you can get a second opinion. Doesn't mean you're cheating on your doctor. You're just making sure that you're getting the care that works for you. You can interview your doctor or your new potential doctor, asking questions like, how do you usually treat type 2 patients? Or what's your philosophy on lifestyle changes versus medication? Their answers to these questions will tell you a lot. And finally, remember that you can leave. You are allowed to break up with a doctor. It's not personal. You are literally their customer. And if you're not happy, you can walk. Now, I know that it can be overwhelming to switch providers because you're like, ugh, I have to explain everything all over again. I have to tell someone new my whole life story. I have to, maybe I have to fight for certain prescriptions. And I know it's a headache. You have to transfer the records and do all the things. But if you're finally getting the care that you deserve, it's 100% worth it. Here's something I tell people in the community all the time. After every appointment, ask yourself 3 simple questions. 1, did I feel heard? If you felt dismissed or brushed off, that's a red flag. 2, do I understand my next steps? If you walk out more confused than when you walked in, that's not okay. And 3rd, do I feel respected? Respect looks like options, collaboration, and honesty, not shame or blame. If your answer to any of those questions is no, that's your sign to reassess. Sometimes it's a one-off bad appointment, but sometimes it's a pattern. And if it's a pattern, you owe it to yourself to find a better fit. Finding the right fit can take time, but when you do, it feels like a weight lifts off your shoulders. Instead of dreading appointments, you look forward to having someone in your corner. So here's the big picture. You don't need every specialist out there. You need the right ones for where you are now. And just as important, you need the right fit. The doctor-patient relationship should feel like teamwork, not a power struggle. And at the end of the day, managing type 2 diabetes isn't just about medication and numbers. It's about building a team you can trust, people who see you, respect you, and support you in creating a life you want to live. Thanks for hanging out with me today on Sick of Pricks. If this episode gave you some clarity or even the courage to rethink your care team, share it with a friend who might need it too. Don't forget to like, subscribe, and leave a review. It helps more people find the podcast. And let's connect in my support groups over on Facebook. You can find the links in the show notes. And until next time, take care of yourself. You're worth the effort. Thanks for listening, and I'll see you next time.